in different clinical conditions. So you have heart disease and asthma and pregnancy, and understanding how to do exercise prescription in these different conditions. There is another course called the World-Class Athlete, which is about understanding what makes an athlete world-class in a different discipline. So things around the genetics and nurture and all these things, but also if you are working with world-class athletes, how to maximize their performance. So it's understanding why people are world-class, and also if you're working with a team in a role as a sports doctor or a physio or a sports scientist, what you can do to try and help maximize their performance. And then the final option in the X option is called Sport and Exercise Medicine in Practice, which is very much around being a team doctor. So you do things like anti-doping and medico-legal factors, and how to prepare teams for going to altitude or hot conditions, and all these things that you need to do essentially to be a team doctor. So you choose one of those three. Then you do a Y option. Again, there's three different options. There's one called Physical Activity and Health Biological Mechanisms. That's the course that I run. So that's involved with understanding why physical activity is good for you. So we look at the epidemiology, we look at some of the biological mechanisms. So how does physical activity influence lipid and lipoprotein metabolism, blood pressure, insulin resistance, and a bit around physical activity guidelines and where they came from. And there's two different variants of sports injuries. So one is for if you are a doctor or a physio, and one is if you are a sports scientist who might be more involved in sort of rehabilitation rather than diagnosis of injury. So which version of those courses you go on depends on your background. There is quite a lot of overlap, but then it sort of branches out and there's sort of different specializations depending on what your background is. And then there's two Z options. One is Physical Activity and Health Public Health. So this in many ways is a sister module to Physical Activity and Health and Biological Mechanisms. The biological mechanisms is why you need to be active and how much you need to do, understanding the dose-response relationship. And the public health aspect is very much about how do you get people to be more active. So one is, this is how much activity people should do and this is why. And then the other thing is the whole behavior change piece about how you might help people to become physically active, because one of the things that we know is just telling someone that exercise is good for you and you need to be more active doesn't work, right? So you need to actually help support people understand barriers and facilitators. So it's all about the behavior change aspects. And then the final course is called Ergogenic Aids. So this is about all the things that you can do to try and improve performance. So it's about nutrition and supplements and all sorts of things that you can do to help an athlete become better, and that's the course that Stuart Gray runs. So there's the two talk components in year 1 and year 2. 60 compulsory credits in year 1, 60 optional credits in year 2. Then year 3 is the project, and for the project it's 60 credits, and there's a range of things that we can do in the project. You might some people have access to various populations in their jobs, so you might work in a hospital or with a sports team or something like that, and we might be able to do some research using the people that you interact with on your day-to-day job. There are options to do internship type projects where you work alongside a team and you support the team to try and address an area that they want to improve on. So it might be doing some research around their youth team or something like that to understand different training programs. No, there are various things that you can do which are supporting a team. There are outreach type projects which involve going out to people beyond the scientific sphere to try and communicate science. I've just developed a really interesting project which involves developing a program to going out to schools to actually help them learn about the heart. Well, we've got these really cool things. I'll show you them. Actually, they're very cool. Well, we've printed out these 3D hearts that they can sort of play with, and we've got hearts of all sorts of different sizes. We've got hearts right as small as like